Welcome. Come with me. The doctors will see you now.
Welcome back to Fast Talks with Family Docs. I am Dr. Phil Palmer.
And I'm Dr. Veer Vidala, and we're back with Dr. Alyssa Penick, where we've been talking about fertility awareness methods and all of the nuances behind it and what amazing work that she's been doing for her patients. Thank you again for joining us, Dr. Penick.
Absolutely.
Yeah. So, Dr. Penick, at the end of our last episode, we were discussing some of the other conditions that can be diagnosed unrelated to just infertility or attempts to conceive. So what are you using this method for in the clinic, engaging with patients and helping them understand their health conditions? Can you continue to expound a little bit more from where we left off last time?
Yeah, sure. So I would say the majority of patients who do come to me for workup of issues that are wanting to chart their cycles or have been charting their cycles do tend to be like infertility, recurrent miscarriage patients. But I have patients who, they've never been sexually active and they have irregular cycles or painful periods or a number of those issues, PMS. Mm-hmm. They just know that something's off and they may have already been charting their cycles and had some clues and some that have made them want to go further into figuring out what's going on. Right. One of the really great benefits of them working with instructors, which I don't teach them to chart their cycles, but if they're not already charting, I give them a list of instructors that they can contact in the area or work with virtually. But a number of those instructors do have enough training that they go, something's off here. You need to go see a doctor to look further into that. So they will be kind of channeled to be able to figure out what's going on with that. So a lot of PMS, a lot of irregular cycles. Again, we were talking about PMOS and insulin resistance being a big part of that. Mm-hmm. Endometriosis, I would say of the patients that I suspect have endometriosis based not only on their history, their clinical signs, painful periods, pain with intercourse, but some of their signs on their charting that would indicate that there is something going on. I think all of them that have gone for further workup on that, endometriosis has been there. I actually have one patient that ended up having stage 3 endometriosis. She was charting her cycles. We did the workup and had been trying to conceive for about 2 years, no pregnancies. We didn't find any hormonal issues on her workup. And I said, well, based on some of the markers that she had, so one thing maybe more than 2 days of what we call tail end brown bleeding. And so after they finish their normal period, they may have dark brown or black bleeding for 3 or more days at the end of their menstrual cycle. So this patient had tail end brown bleeding, had very limited cervical mucus, which can be either a sign of hormonal issues or inflammation of the uterus, the cervix, had significant dysmenorrhea. And so all these things in conversation, I said, I really think you need to go be evaluated for endometriosis. So she went to an excision specialist. They found stage 3 endometriosis. And after several months of the excision, she was able to conceive and had a healthy term pregnancy. I got to deliver that baby. And so it was just, very wonderful. And so it's so exciting, even if it wasn't anything that I have actively do in every single case, to be a part of that and to be able to coordinate care that makes a significant difference in a patient's life, And so many people go, I have pain, but that's, it's normal. My mom had it. My sister has it. Well, you're having to take 800 milligrams of ibuprofen throughout the day for multiple days, every single cycle, in order to keep yourself functioning. That's abnormal. And so we need to do something about that. So being able to really identify what is normal, what is not normal is such a big part of it. And helping people feel heard, feel validated in something that's not normal. One other big thing that comes up is, male workup. And so typically, you may say, seminal fluid analysis, that's normal. Everything should be working just fine. But we still need to be looking, and we are primed to do so as primary care doctors, to look at, do, the partners have thyroid issues? Do they have obesity, sleep apnea, thyroid dysfunction, all those different things that are going to affect their metabolic health and perhaps their ability to, have, a good, male genetic component to the whole story.
You had mentioned instructors. One of the things I'd come across is that someone who wants to pursue this may need some formal guidance or need to go to a class. Is there, is it just like a one-time visit? Is there an online course? Is it a couple sessions? What do they do with an instructor if they're interested in pursuing fertility awareness method?
If I have a patient that's interested in learning any fertility awareness methods, I have a handout that I give them about, again, what is a fertility awareness method and the contact for local instructors.
Okay.
So depending on what it is that they want to learn, it may be more or less time and labor intensive. The nice thing about a lot of instructors is they will often work on a sliding scale fee, and the devices that they may use for some of the types of fertility awareness methods are FSA and HSA eligible.
Oh, so cool.
Yeah, so like Marquette method, or anybody that's using the Mira or the Anito monitors or the ProOb test strips, or Aura may also be FSA.
Aura is, yeah.
Yeah, and so there's a lot of ways to make what may be the most costly fertility awareness method more cost effective if they have an HSA or an FSA account. So for some of them, like Creighton is probably the most standardized, and so it can be the steepest learning curve, particularly if I have a patient that has irregular cycles, because it can be really frustrating. If they'll often have one of two things. If, for example, they're not ovulating, they may have mucus every single day, or they may have none at all or extremely limited mucus, and that can be frustrating in the moment for them, but they work really closely with that instructor. Usually it's 8 sessions in the first 6 months, I think, something like that, so that they really get to know what it is that their body is saying, and it helps greatly with knowing what it is that they're not doing, their body isn't saying and needs, support with. Yeah. And it helps me greatly to, again, be able to say, okay, let's talk through when you're going to get certain labs at certain times of your cycle, if you already know and have familiar with what's going on.
Right. Excellent. Thank you for that.
And you're a faculty at St. Anthony's in residency, and I feel like this is a big passion for you. Do your residents have like a track where they can kind of learn this skill from you, or is that something that's being put forward?
Yeah, but I would love that.
Okay.
It's, if I were to have the time to do everything I wanted to do, I would love to have a dedicated time where I'm just seeing my patients for NAPRO concerns. And so NAPRO, I don't think I've mentioned it, but stands for Natural Procreative Technology. So really the first step in my training in all of this was doing NAPRO medical consultant training when I was in residency with the St. Paul VI Institute in Omaha, who developed the Creighton model of fertility awareness methods and a number of the diagnostic and therapeutic techniques that I use often for my patients that come to me. So if I were to have a dedicated NAPRO clinic, that would be absolutely wonderful, and that would be an absolutely perfect avenue for patients to just come, and then residents could come learn with me.
Yeah, that's true.
I feel like every time I have a medical student, I have at least one patient that's coming to me with the charts, and so I'll just chat with the patient and say, "Oh yeah, like look at these charts," and to them, most of the med students go, "What am I even looking at?" And then we get to talk all about what the heck it is that I'm doing, this weird stuff that they didn't get to learn about in depth in medical school.
Yeah, right.
We have one resident that just started, and he rotated with us as a sub-I.
Okay.
So because of that conversation, he did an elective through the Facts About Fertility program to learn more about it. And so he reached out and let me know. I was so excited to hear that.
Yeah.
So just to be able to make a difference in showing people what are some other tools in the toolkit that you can offer patients is super exciting. as it is, we have incorporated it into our gynecology curriculum. So they meet with me for like one lunch session, and I have a couple of articles that I give them about the kind of the utility of fertility awareness methods, some of the data on it. And then we kind of talk about the takeaways, and then I go through essentially exactly what I presented at the OAFP. So it was pretty nice to just take that lecture I already had and polish it up for the OAFP in Tulsa. So those are the big things that are mainly incorporated into the curriculum right now, with hopeful plans for more.
Good. So I have a kind of a question with a part B to the question, and you've touched on it a little bit, but I'd like to ask you to be real specific here. So if watchers or listeners to Fast Talks have an interest in developing more of an understanding of this so they can better incorporate it into their own practice, where would you point them? And along those lines, what have been resources that are very useful for you in getting to where you are at this point and as you continue to practice FAM?
Sure. Where I started was in the formal training was doing the NAPRO Technology Medical Consultant training, which was 2 weeks or 1 week in October, 1 week in April, over 1 year. And it is, a CME course to be able to really go in depth into understanding charts better than I already had understood them for Creighton specifically, and then how to utilize them for diagnostic workup. For something that might be a little bit more practical, FEMM, FEMM has an online self-paced a course that you can do. And so that online course is a precursor to a live course that they offer both in person in Columbus as well as virtually. And so I think they have the biggest cohort this year. It's every June that they have that weekend session. So that I have not done all the formal training yet, but I'm really excited to do it because it goes, I think, even more in depth into all the hormonal testing and treatment and how do we optimize these for the sake of good cycle health. Facts about fertility, I think, is a really good kind of start here if you want to get more in depth with it. For professionals, it's a great resource for a lot of different really articles on the efficacy and the data. There's a lot of articles on where people are teaching patients in developing countries these methods just because of the lack of access to more conventional methods of preventing pregnancy. And so some of the ones that I haven't mentioned would be like the 2-day method, standard days. And so like things that don't take a lot of time to teach people, but can really help them to get more insight into, all right, if I want to space some pregnancies, how do I do that without having a bunch of fancy technology or, like regular access to pills or whatever it is that may not be practical for people living out in the bush, in sub-Saharan Africa, for example. So, but that's a really great place to go and get a lot of good information. And they do have, like for medical students and for residents, they have courses that you can do where a lot of it is virtual. So you'll call into sessions with some of the preceptors, and then you can sit in clinics virtually with some of them just to see what does that look like in clinical practice. So I've that's something I'd really like to make more aware, even for our residents who want to do more with that.
Yeah,
it's great.
Just a question that is kind of more as a resource. Do you take referrals from outside facilities, or is this like just you do? Okay, so it's not just like within your family medicine clinic. Wow. Do you have like a large wait time, I'm assuming?
A little bit. It's not as bad as some people. I would say right now I'm scheduling in August, which is not bad. But ideally, if somebody is already charting their cycles, then we can get right into it when they see me.
Awesome. Great. Well, hey, I was going through, the CV you sent us, and beyond this, something that made me stop is you are kind of doing it all. I hear you love to travel. You do martial arts, and sign language, which is fascinating. You're teaching, you're seeing patients. One thing we always like to ask our family med docs is, how do you guys balance it all? How do you do all of it and still keep up with your clinic, but then how do you protect the time that you have for yourself?
I usually feel like a duck, calm on the surface and just like frantic underneath all the time. So the big things for me are, first off, I am part of an absolutely fantastic program. I have such supportive colleagues that help me to keep my family at the priority, because at the end of the day, we have to be able to take care of those things outside medicine that are going to be there when we are no longer practicing. And so I really feel like I am able to do that. And I have an incredibly supportive husband and wonderful children. So they really, help me to go, okay, what am I doing this for at the end of the day? It is true that, even when you're juggling tons of things, I heard several years ago that you have to decide which of the balls you're keeping up in the air are glass and which of them are plastic, and keep the glass ones up. And it's okay if the plastic ones fall sometimes, because you can't do it all.
Yeah.
You have to be able to sleep sometimes, and
Sure.
it is what it is. For me as well, my faith is very important, and it really motivates me. And so putting that at the center of every day to help me remember why it is I'm doing what I'm doing really, really helps me to change my attitude and do it for the reason that I need to, serving people because they have inherent dignity and worth, even if it's hard to see that sometimes. And at the end of the day, that is what I'm called to do. And I really think for me, medicine is a calling. And so I've got to take that time to discern what I need to be taking on at any given time. I think, was it Eleanor Roosevelt that said comparison is the thief of joy? And so if I compare myself to everybody else who's doing everything, you're going to suffer. You're going to feel like you're not doing it all. But at the end of the day, when I sit back and I go, oh my gosh, I've got a weekend ahead of me where I can just take my children to the library and just go for a walk with them. This is the weekend that I am looking forward to. Like a life of just peace and comfort because of the things that I do with my work time, and also trying to leave my work at work. Those are all things that help me to, balance it, if you will.
Yeah. Well, Dr. Penick, thank you for those personal encouragements, but also just the willingness to come and have this fascinating discussion with us. It's been a pleasure to have you with us. Dr. Vidala, great seeing you. And
always a pleasure.
And working with you again. And viewers and listeners, thank you for your time. And we'll see you again on the next episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.